All right, welcome. Good morning, one and all. Really lovely to have you here. A very warm welcome. As you're joining, if you could just pop a 1 in the chat so I know everything's working and we are functioning as we should. I say that with some trepidation because of the conversation we've just had in the green room, but functioning as we should is what we need. Thank you, Zahira. That's at least 1. Lovely to have you all here. Great. Pings in my ear all day. Okay, welcome to the very first Exon Health community webinar of the year 2026. It's going to be a good one. We've got a heck of a year ahead of us. We're not going to try and cram it all into the next half an hour, I promise, but I do want to just hint that the future is bright and there's some very, very exciting things on the way. Today, well, actually, I'll just start with this. We've also had a little bit of good news, wanted to mention before we kicked off, just to say that Surgery Intellect, powered by Tortoise, excuse me, has officially received IM1 approval to file directly into the clinical systems, EMIS System 1. So just in case that was preventing you from signing up for a free 3-month free trial, the link is going to be in the chat conveniently. So I should just suggest that maybe go ahead and do that. So there we go. That's all I wanted to do. I just wanted to mention it. Right. Today we have the semi-famous Patrick Denston on the call. Could we all get a round of applause and a slight curtsy? Yes, Patrick, semi-famous. He's here from Alexander House Surgery, business practice manager there. He's going to talk to us about voice agents and their use of voice agents in a very interesting way, the impact it's having on their practice. But before I do that, I'm really keen to understand from you, the audience, the people at large, what piqued your interest about the content today? Was it, and if you're new here, what we like you to do is just pop these comments in the chat. So if you'd like to just jump in there and tell me what piqued your interest. Was it that you're keen to start using voice agents across your practice, or perhaps you're just keen to find out what they are? Or, and this is my favorite, did you just want to decipher what we meant by Omni Consultations? Any of those, pop them in the chat. Keen to start using them. Thank you, Ryan. Anyone else? Whilst you're doing that, and really no overthinking it, just whatever comes to mind first of all. This is a safe space. I'm going to go through the little bit of housekeeping that I do at the top of every call, just to let you know that the call is going to be recorded for prosperity and sharing. So if you are going to have to drop off at any point, we know you're busy people, you're not going to miss a thing. I'll send the recording out later. Second of all, we love the questions, so drop those into the chat where you are right now, dropping some very interesting comments on why you're interested in today's webinar. If you could put your comments in there, we'll get to them as and when we can throughout the webinar. My name's Lucy Glynn. I'm the community manager here at Exon Health, and with me today is, as I say, the man that wears many hats, Mr. Patrick Denston from Alexander Health Surgery, and our forward-thinking product director, Melissa Latto. So we are in for a real treat today. How are you both?
Yeah, very good. Thanks. Yeah, really excited to talk about Omni Consult. So I think it's something that the three of us have been discussing for a long, long time, and it's nice that it's now being shared and aired with everybody else.
Shared and aired. I like that one. Yeah, go on, Mel.
I was just happy to be here. I love talking about what we're doing and how we're doing it, and just been a while. So it's nice to talk to everyone, and Patrick to show you what we've actually been working on. I'm excited to him to share those thoughts.
Yeah, it does feel like it's been a little bit of a while, doesn't it, Mel? But we're going to throw you in at the deep end this morning, aren't we? And dive straight in. So I think everybody knows you, product director at Exon Health, but they probably know less about what you've been bubbling away in the background doing over the last few months, years, perhaps not, months, more so. Yeah. So voice agents. We've all heard the buzzwords. It's definitely going to be one that's on the radar this year for most people. But what does that look like at Exon Health?
So with voice agents, it's something that we've been really keen to do. But what we're trying to do is not just do it where it's going to destroy the patient habits that everyone in practice has actually worked really hard to create. So we're looking at them resolving workflow problems, hence the Omni Consult. So online consultation, big problem out there. It's moving a problem from the telephones over to online, but it isn't actually allowing the patients to be able to access no matter their digital needs. So what we wanted to really do was create that omni channel so that the online consultation process that's being embedded into practices is available for everyone. But actually not creating that overhead still on the practice staff to be able to have to fill out those forms on behalf of the patients that can't do it themselves because they don't have smartphones or access to the internet. Even you don't know what people's limitations are these days. So yeah, we're really trying to think of ways that not only the Omni consultation is the first step in this, but we are thinking of ways that all of this can be done. So the appointment management, your prescription line, your appointment reminders, even for that outbound flows. So we're really thinking about absolutely every reason that the practice could get contacted by a patient, where there are ways of doing it online, but those that can't still need that route in. And we're really trying to work with the likes of Patrick to ensure that we think about those workflows, make sure we break them down into their nice bite-sized chunks to handle clinical safety as well, because it's really important from our perspective that it's not that just, hi, how can I help? Because if you're doing the hi, how can I help, what does that actually mean to the patients? Do they learn that if they say certain words, they get through to the right practice staff or they get seen quicker? And the patient habits that everyone's been creating over the last year or so with bringing on the online consultation tools means that they are trying to triage in different ways. But by just putting a voice agent up front that just resolves by you answering a couple of questions, them to get through to a person quicker, is that the right thing to do? So we're just really trying to keep the workflows that are there already in the practice and offer that channel through a voice agent as well. And please excuse my voice, I might cough on occasion. I'm trying not to.
You're a hero. And so, Patrick, is that how you're handling it at Alexander House? How have you implemented Omni Consultation?
I mean, that makes it sound, it's just the future is there as well in that description, as well as what we've currently been piloting. So I think for us at Alexander House Surgery, we don't have particularly long call waits. We don't have that 8 o'clock rush that other people have. We've utilized digital tools over the last few years to try and make things as slick and as efficient as possible. And one of those things was leaving online consultations on 24 hours a day, which has allowed us to stack up our day, get the most appropriate care before we actually open when it's not rushed. And when we started looking at the data 12 months ago, we realized that was great for the 15% of our population that wanted to contact us by a digital online channel. And some of them were doing it 3 o'clock in the morning, 4 o'clock in the morning, and that was brilliant, but it wasn't equitable. 85% of our patients still wanted to contact us through the phone. And whilst there was lots of things we can do with Xflow to make it that an efficient journey and navigate towards digital, it's still not equitable. So the ask was, is there a way of actually getting that information across from the patient over the phone into a similar format so it is equitable access rather than just another type of access that might suit some people more than others? And that was sort of, Mel and I discussed that just over 12 months ago in depth when we were both trying to go home, and I was like, I've got a problem, can you fix this for me, please? And over the last 12 months, you did promise that we would get it and we'd try it and give it a go, and actually I think it exceeds the expectations. And what Omni Consult is exactly as it's described in its names. It allows any type of contact coming in, but it goes into one pot. So you're not ending up with another dashboard. You're not ending up with another pop-up needing a 5th or 6th screen so that you can actually manage all the contacts coming into the surgery, and then coming up with a different idea for what your clinicians do and what everybody else does. And it allows you to triage those patients appropriately at the start of the day, so that a patient that might be calling up at 10 o'clock in the morning with some complex needs is getting a worse sort of level of access than somebody that is digitally savvy, that sends in and takes 2 minutes to fill out an online consultation form at 6 o'clock in the morning before they go to work. And that's exactly what it does. It's provided equitable care. But I think with all tools, there are different use cases for it. And I think that the exciting part is that whilst it wasn't a problem we had, it will be a tool to help patients and practices with that 8 o'clock rush. It gives the patients the choice as to whether they want to wait to talk to somebody, but if they are in a hurry, there is an alternative. It allows sort of better navigation. It creates a level of efficiency that we haven't seen before. And I think it's probably the next sort of iteration, as big of a step up as going to voice telephony in the first instance. This is just as big of a step when it comes to patient communications.
And so if we overlay, and excuse the ignorance here, but if we overlay the challenges faced by lots of practices in the wake of the 1st of October contract changes. Does this solve that problem in some way, shape or form? Or to coin a phrase, doesn't necessarily solve the problem, but offers another tool to aid and abet with the problem?
It's certainly, it's a tool that will help the problem. And by creating the efficiency, you don't have a patient who spends the first 30 seconds complaining about how long they've had to wait to get through to the practice. And if you've got 600-700 calls coming in a week, that's a lot of time wasted just apologizing to a patient for something you can't help. So that's problem number one. The second bit is, I think the big fear with turning online consultations on throughout core hours was that actually you have very little control over your demand. But when we experimented with that a few years ago, we decided to leave it on 24 hours. We turned one off, our telephony went up. So patients are still going to try and access you, but if you turn one access point off, they just get more frustrated and complain that you've forced them down a different channel. And they have to then sort of learn which is the best channel, which is the channel do they need to use at that time of day, how are they going to get through? And it shouldn't really be a challenge for a patient to access care. It should be as easy as possible. And if you can make that efficiency there, it then frees up time to do something else so that you actually can do proactive care rather than reactive care. And this smooths that over a lot.
And that's certainly an aspiration, I think, for everyone on the call and the government, it seems, this year. So good. Okay. Just coming back to your experience with implementing it, did you face any challenges with introducing the tech, particularly to patients who, essentially you're giving more choice to?
So I think there was a challenge from clinicians. They all just went, "No, that sounds rubbish. Our patients will never use it."
Everyone on the call there, yeah.
They just said, "Can't see the benefit. I'm just going to get more consultations in the day." And you're like, no, that's not the point. And then it was, well, you can try it if you want, but nobody will use it. And on day one, they were right because I'd set it up wrong. So we told all of our patients, and on day one, I didn't get any. And I was like, oh no, am I going to be eating humble pie and apologizing to Melissa for developing a product that actually is unlike? But it's providing a level of choice. So it uses a digital tool for those that aren't digitally able to contact the practice, so they can still choose to wait. They can see what our waiting times are on our website using one of the other Exxon things. They can go in through the surgery assist and they can see there and they connect straight in. But it gives that choice. We're not forcing patients down a set model, which I think some of the other AI voice agents, you don't get choice. You can only talk to the AI bot, and I think that's getting mixed reviews across the country. Whereas this, you can choose where it goes in your Xflow, how you use it, what times of the day you utilize it. And the patients that have used it are liking it. We've had some really positive feedback where the speed of which you can reply is very high. But for us, it's just created a back office efficiency that allows us to react quicker, because it's much quicker to read a form that's already filled out with the questions answered, to know where to navigate that to, than it is to answer the phone, ask those questions, type it in, possibly word it in your own words that might not actually convey what the patient's saying or feeling, which can be lost in communication or context. And so it's working very well, but it's still a patient choice.
Interesting. Okay. And out of interest, with the feedback you've had from the patients, is it from a particular cohort of the community, or is it completely varied?
So we've had a mixture. So our PPG viewed it first. So I talked to them about the concept long before it was built, and they were open to the idea. They think there is a mixed understanding of what AI is, but actually the patients that are using it is a very varied demographic. It's young right the way through to 18, 90-year-olds, and everybody seems to. It's quite simple. I think the only where we've seen challenges is where people either deliberately want to trip it up, or see it as like almost the sort of the HMRC help desk that we used to have 10 years ago, where actually it didn't recognize anybody with any form of accent that didn't speak the Queen's English. So they're saying things louder and clearer like a Brit abroad. It doesn't. It's not designed for that. But if you speak to it like it's a person, it's brilliant. It picks up everything. It gets the context. It summarizes it well. And I think that there'll be a little bit of trust growing there. But 95% of our patients, it works brilliantly. It works perfectly for them, and the concept works.
Okay. So any tips? I suppose there's some interesting questions in the chat, mostly around which other solutions it integrates with from an OC point of view. Melissa has come back and said we're looking to integrate with other OC providers. I know there's certainly one or two conversations in flight at the moment, so watch that space. Any tips, Patrick, on those that may be considering implementing this sort of tech in their practice?
So I think the big tip would be analyze your Xflow system to start with. Talk to whoever your go-to person is at Exxon to look at where you can make efficiencies before you put it in. Because there's been a lot of development over the last 4 years as to what you can do with the Xflow system. You can make it as complex as you like, but you can almost get into a lot of your care navigation in an automated fashion, and you can get it in and out of hours. So to get the most from it would be to make sure that your Xflow is as optimized as it possibly can be, and really take your time as to what you want it to achieve, and be open to new ideas.
And I think that's where this all started, isn't it? Patrick had a new idea. He reached out to the product team, and look where we are, less than 12 months later. So I think that's a lesson to us all. Cool. Okay. Peter says, so the bot talks with the PT and doesn't allow an outcome. Does the human receive a transcript of the conversation for them to then action? I think this is one for you to pick up, Melissa.
Yeah, absolutely. So the bot will talk with the patient, but it's not an open discussion. It is very much a question, answer, and repeat back to confirm that we've understood is correct. That transcript is then captured in response types to add information to the form, as you can see on the screen here, hopefully, whereby the human is kept in the loop. So this goes into the practice inbox, and then they work through the triaging. We don't have any patient comms back at the moment. It's not something that was deemed necessary because we're doing it as a question, repeat and confirm before we move on to the next question. So we don't have to provide the transcript back. But if this was a full LLM model where it was a conversation, then we would need to send the information to the patient for them to confirm the information was correct. So what we did was try and take that additional step out of the loop to ensure that they didn't have to have a smartphone or receive an SMS or have to open up a web page to view that form, because obviously that goes back to that digital inclusivity that we are trying to remove the barriers around that by doing it in this way. I hope that kind of answered the question.
Yeah, I think it does, and it speaks to the equitable access element, doesn't it? Which is really what this has been designed to solve. Having listened to your podcast, Patrick, I'm really trying not to say it's a tool to solve all of your problems. It's not a solution. It's a tool. It's a tool. Right. Speaking of tools, I've got questions. Right. Hang on. So I think, Udin, this one has been answered. So how accurate is it with accents? How does it cope with that sort of thing? It seems that it handles normal conversation very, very well. How much reception?
I just guess the key on that is, even if you're not sure, you still have the call recording that you can listen back to. So if it doesn't sound like it's right, the one good thing is the voice agent captures the transcript, puts it in the response, and keeps the audio. So you can listen to the audio, and you can speed that up so you can put it on 2x or 4x so that you can listen to it quickly if you want to. So that is a backup there.
And that's presumably because it all works within your Surgery Connect system.
Correct.
Fabulous. Right. So how much reception admin, let's get into the crux of it now. Thank you, Mei-Ling. How much reception admin time have you saved versus the cost of the product, Patrick? So, this is a tricky one to answer.
I mean, it's a great question, and I know Mei-Ling quite well, so I'm fully expected to be grilled on that privately afterwards. So I think, so it's not necessarily, so it is a time saver, but that's not as important as how much it levels out the demand coming in. And I think that's right. That's sort of a key. It's an aid. It's not meant to replace your receptionists. However, you could see a world where you could utilize it if you're struggling to recruit receptionists. During the pilot, we had some bouts of sickness just before Christmas. It took that pressure and stress away, because you knew that actually patients that were choosing to wait were doing through choice, not because they had to. Similarly, if a receptionist gets called away, if you've got a team of 4 receptionists answering the phone and one of them gets called away because they need to go and speak to a doctor or suddenly chaperone, you lose 25% of your capacity. It's a nice peace of mind to know that it's there and it can be picked up from a laptop anywhere in the world or other sort of safe, secure devices. So that was probably for us a bigger benefit. It was never designed to be a cost-saving exercise. it just means that you can spread your resource over the day, and also spread your demand over the day, or choose when you want the demand coming in, like we do. So we have it before our phones come on. This is available. AccuRx is available. So our patients can contact us before we open, before clinicians come in. We've got people working on it.
Yeah, I mean, you've used a lot of words there around it's about not forcing patients, it's about choice, and equally, I think as practice manager, it's about choices, how to utilise it in the best way for your practice, isn't it? So, yeah, great answer. Okay, interesting question from Udin. Can this just be integrated into the current phone system if you're a surgeon? Without any risk assessments, as we've hit a slight stumbling block trying to get Surgery Intellect because of the DCB 160, DCB 0160. Melissa?
So you always carry out a DCB 160 for every bit of tech that you're implementing. This doesn't actually fall under a med device because it's not using a large language model or doing any summarization. It is just purely text to speech. So that's what it helps as well to be able to put that into place, because it's got a specific task. And the DCB 0129. I've forgotten the number. No, it is 0129. Oh, I thought I forgot the number there. It's obviously something that we have to do to make sure that the tech is clinically safe to be able to provide it to you. And that's all on our hazard logs as well. So I don't know if Patrick can probably expand on this a little bit better, but there wasn't or isn't too much clinical safety risk around using this, because it's the same as you using the OC tool. It's just capturing it into a different place. So it's just your business processes around.
Yeah. There's I'm just going to plug it because it's something else that I did that Exxon facilitated, but there are some days about clinical safety and utilizing AI. And that to me was a really big eye opener, but it was also very, very useful. And I think there's some more dates across the country coming up, which I'm sure Melissa will share those. But it goes into the detail. It's really useful. And that it's not a sales pitch. It's talking about those safety points, and there's an educational piece. It was really useful, and I think that would answer a lot more of people's questions when it comes to things like
that. Thank you for that, Patrick. I didn't prompt you at all, but I know you did enjoy the day very much. So I have popped a link into the chat if anyone's interested in joining us on the AI tour. It's, as Patrick says, very much an education piece, so much so it's CPD accredited. It's led by Dr. Don Pimenta from Tortoise AI. So Mei Ling has been quite pushy with a couple of questions in the old chat. So I will go back to one of her earlier ones. What is the interface with the OC platform? E.g., how does it go from phone call to GP triage inbox?
Should I take this one, Patrick? So it's our inbox that's actually on our phone bar. So we have created the own inbox. Hopefully you can see it on the screen. So you will literally, as the phone call comes in, so we have a patient identification first. So we have to identify that patient has been registered to the practice. We then pass all that information plus the identified patient through to the phone bar in our forms inbox with the completed form and the audio, for then that to go through a full triage responsing. So you can move it through its status and waiting, assign a priority, a severity of what the actual problem is, add comments, add SNOMED codes to it, all the activity of what's happening during that form. Once it's in, it's being logged. So if you send the patient an SMS or you call them, it will log against the activity in that form that those actions have been done. And then that can all then get filed back to the clinical record as well for a single click once it's completed.
Fantastic. There's some questions in the chat around price, Melissa, that I'll let you pick up independently. But Mei Ling's very chatty today. Did you bring her along especially, Patrick? But I do want to just ask, Mel, because I know that this, or rumour has it, that this is just the first of many. This is the start for voice agents from Exxon Health. So I wonder if you could tell us what might be coming next. Just wet our whistles. Just a little bit.
Our whistles, indeed. So, future of voice agents, one I prepared earlier. So during the first two quarters of the year, obviously the online consultation collection, we want to integrate with other providers. I know there was a lot of that on the chat earlier. So we are in contact with a couple of providers. we've got to identify the clinical safety and ensure we are doing it safe and secure with those handoff points and who's responsible for what. So that's taking a little bit longer than expected, but we are already in discussions and we have integrated with one of the APIs. We're just going through the final IG around that to make sure that it's all completely clinically safe. The next step, which is actually in build at the moment, is appointment reminders. So this is your outbound voice agent. So you'll be able to say, identify what patients have appointments up and coming. So you can give them a call for the voice agent to say, just to remind you that you have an appointment with your doctor for XYZ. Are you still able to attend it? So it's a confirm and cancel option, so people can actually then say, yes, I am going to be attending, or no, I'm not, I'd like to cancel that appointment to hopefully free up some of that time. That can work in a variation of ways, so we can do it for scheduling on appointment slots, or do an uploaded list, so you can say go and contact these patients. So if you've got people that DNA quite often, you can target those specifically if you want to. Obviously the inbound of that's going to happen as well, so we're going to look at doing the book side of things, so patients can call in and book their appointments. So as most of you know, we've got check and cancel for EMIS at the moment. System 1 will be coming in the same format as EMIS, and then we will look to move that to a full voice agent functionality to be able to book, check and cancel through a voice agent. So again, anywhere, these will be able to put anywhere in your call flow. You control where it's available, you control what slots are available to book and cancel, you control the opening times and the calendars that all sit behind that, so the full Xflow functionality. And then the big one that we're trying to work towards is our surgery assist chatbot that we've got that you can have on the website, is giving that a voice. So we will start with the general inquiries questions: what time's the pharmacy open, what's the address, is there car parking, and then we will be moving that on to the signposting elements as well. But again, completely in control of whether you want to use it or not, how much information you will be able or want the actual surgery assistant, if you like, to be able to communicate. We have a lot in consideration. I would love if anybody can see that list very clearly, 1 to 7, which ones would be, more interesting for anyone. So appointment reminders obviously is in my list at the moment. Recall reminders for routine screening and checkups. Follow-up calls, so check on patients after appointments or procedures, just make sure they're recovering well. Medication reminders. I feel like this might be something that could be really great. I know I take medication myself. I often forget that I'm running out until it's like 2 days beforehand. So if someone could remind me, that'd be great. Surveys, so your friends and family surveys at the end of the when someone's coming to practice, whether they could be done via a voice agent. Health campaigns, so I know in London there's the TB campaigns that the people are meant to be made aware that they can come and get their TB jabs, so those kind of awareness campaigns. And then test results notifications. So my mind is that we would start with, it's normal, you don't need to ring us, voice agent, and then we could grow from there to be able to say, it's not normal, you need to contact us or book an appointment, and then kind of connect all of those voice agents up to offer a service off the back of it. So that's just some of the things, but yeah, I love it. So Francis, 1, 2 and 7, mailing, 6
they're
and
getting
7.
the hang of it. So yes,
yeah,
if you could just pop in the chat the number that relates to the ones that pique your interest. So Patrick, join in if there's any on that list that you're particularly excited about, please join in.
So all of them, because it's that digital inclusion again. So everybody without an email address or a mobile phone number, it includes all of them. So it's not a manual outbound call from a reception team. I genuinely didn't know this list was coming, so I'm quite excited by all 7. And I think they'd all be very useful and very welcomed. I think the other thing,
any standouts though that would be like, oh my god, if we had that today, it would make a massive difference.
So I think, speaking to sort of colleagues across the country, there's been some caps on fragments of SMS messages per patient coming out, and I think that's going to, as a cost factor, will be huge when it comes to friends and family tests, appointment reminders and bits and pieces. So if that's done in a more cost-effective way, from a business perspective, that's going to be a real rescue some of the practices that are going to have that cap put on financially. And I think also the appointment reminders for no-shows is always useful. even if it's a reminder for a telephone call, by calling them and saying you're going to have a call in 5 minutes, you're the next patient on the list or something like that would be useful. So I think is some patients don't need to come in and don't want to come into the surgery. They are missing calls because actually the call window is quite great. So that sort of thing would be really useful.
Very good to hear. I'm going to stop you there, Patrick, because we have timed out. But this is good. This always means that there might be a part 2 to this if you can't stop them talking. Right. Just one question I do want to loop back to, because it has been asked a few times, and that is just around whether or not this goes straight into EMIS System 1, the EHR systems. Can we clarify?
Yeah, so it doesn't go straight in. It's a decision of the practice if they want to file the information back to the EHR or not. So if you are running another online consultation tool, you can still run this one side by side, because you don't have to, nothing's automatically going to the patient's record.
Fantastic. Okay, and on that note, we will call it a day. Thank you ever so much for your time today, Patrick, and yours, Melissa. It's been great to have you both on board. And to everyone who's participated, thank you ever so much. It's really appreciated. Our next webinar will be in February. Can you believe it? So keep your eyes open for a potential link. In regards to this one, I will, of course, send out the link and recording in the next couple of days with all the relevant bits and bobs that you've asked in the chat and I haven't had an answer for. So we will do that. In the meantime, on behalf of all of us here at Exon Health and from Alexander House Surgery, have a happy and healthy January, and we'll see you in February for much more. Thank you.
Thanks very much.
Thanks, everyone. Cheers.
Bye-bye.